So I'm very pleased to have with us Caroline Beacham, and Caroline completed her honors BA in kinesiology from Western University and graduated from McMaster University with her Master's of Science in Physiotherapy. Since graduating in 2017, Caroline has specialized in sports medicine and cancer rehabilitation. Caroline works as a physiotherapist in the community, treating acute and chronic conditions in all age groups, and she has also been with Wellspring for over 3 years now, working as an exercise leader with the Cancer Exercise Program and a presenter for our cancer-related fatigue series. So Caroline, I will pass it over to you for the rest of our presentation.
All right, thank you, Vanitha. And thank you everyone for joining us today for the persistent pain. I realize that it's, usually on a Wednesday here, but here we are on a Monday together. So welcome. And I just wanted to preface this presentation by saying pain is a huge topic, specifically persistent pain and cancer-related pain. So in no means can I tackle this whole topic in 1 hour, nor am I certified to talk about every aspect of this topic. But I really hope that you go home after this, or you probably still are at home, but you take away from this presentation just a couple things that are manageable for you to do to feel more confident in your pain and to start to manage it better. So that's the hope. Again, yes, I will get to your questions at the end, but for now, let's hop into it. So this will be our outline for the day. We'll talk about the prevalence of pain in people with cancer, how it works, why it works, why it happens in acute versus chronic pain, sometimes why it increases the chance of it becoming a chronic pain, and then what everyone's here for is what we can do about it. And there's some resources at Wellspring as well for that too. So we'll talk about the prevalence of pain. So in here, this is coming from a meta-analysis of quite a few studies here. And I think there was actually over 60,000 people that were a part of this meta-analysis. And they found that during treatment, 55% of people just reported pain. And then in those with advanced or terminal cancer, there was actually 66% of people reporting pain. And then what is interesting to me, and is partially what we're talking about today, is after treatment ended and after curative treatment occurred, 39%, so almost 40% of people still reported pain. And in these reports, it was also 60% of these people reported moderate to severe amount of pain. So that's pain that's affecting your day-to-day life, what you're doing. It's disrupting sleep at night. Like this is pain that is no small thing. So that's very interesting. And if you're on the call today and you're experiencing some of these symptoms, know that that's quite common, and that really that's why we're doing this presentation, because it's a common thing that people are mentioning. All right, so we're going to hop into like a quick tidbit of how pain happens. Again, I will preface this by saying it's a bit more of a confusing topic than we're going to dive into, but I do want you to understand a little bit of the physiology behind pain, so you know why it's happening and you know how to control it better. So understanding is wonderful sometimes. So here is a lovely picture of someone. Let's say they stubbed their toe. So he's holding his foot there. The site of injury is his toe. Let's say he stubbed his toe. And how does that turn into actually you experiencing pain? So in the toe or in the skin or in the muscles, there's sensory receptors. So those sensory receptors can figure out when something was stretched too far or compressed too far, if something had a different temperature than usual, so really hot, really cold. Sometimes there could be a chemical change. So chemical change really just means if there is swelling in that area and you're increasing some inflammatory factors, it can detect that. So that's what's going on in the toe right now. It probably found a big compression and maybe some swelling after that, and it's that information is detected, it's addressed. And that information goes up your spinal cord into your brain stem, so the base of your brain, and then your brain takes that information and interprets it. And why that's important is because your brain then has the ability to take action after that. It interprets the stubbed toe, and it says, okay, let's take our toe away from that wall. Maybe you grab it, hold it, put some pressure on it, make it feel better, grab some ice, that sort of thing. Now, let's also say that not all pain occurs in the toe or in a limb, for example. So to explain that a little bit, we are going to jump into why or different types of pain. So that toe compression, that was an example of a nociceptive type of pain. So there's two big categories here we're going to talk about. There's nociceptive pain, there's neuropathic pain. And again, we'll try to simplify this as best as we can, but nociceptive can be a musculoskeletal type of pain. So that's like your bones, your joints, your soft tissues. And then there's also visceral pain, so organ pain. So for example, you can have pain from, yes, a stubbed toe, a sprained ankle. Another thing that could be musculoskeletal would be like a skin burn post-radiation, so damage to the actual skin cells. And then in organ pain, that could be, when you have pain from a heart attack or pancreatitis, that can be some very severe pain. So that's one type, and then the other type is neuropathic. Now, neuropathic, to be blunt, is just something to do with the nerves. So you have nerves centrally and peripherally. So if you have nerve pain from central, that's anything to do with your brain and your spinal cord. So that could be a spinal cord injury. It could be damage to the brain from a stroke. And then peripheral type pain is really anything that's not in the brain and spinal cord. So everything else into the limbs. A popular one is peripheral neuropathy with side effects from certain chemotherapy drugs. Or you can have like a type of stabbing pain and mastectomy scars from scars trying to regrow. So I just wanted to say that although that diagram was cute with the guy stubbing his toe, it doesn't always just come from a limb. It can be coming from internally and be classified in different ways. So it's very much a spectrum from nociceptive to neuropathic. Sometimes it's not exactly one category, it's a couple of them. And that's really how deep we're going to go into pain physiology or pain science here. So why do we get pain? It's horrible when you feel it, but it's actually really important for us. So pain is, as I was saying, a warning signal. It tells your body and it tells your brain to take action and to change something. So this is pain working properly. So let's say, yes, you roll your ankle. It's a pretty bad sprain. It swelled up right after it bruised. You're going to have pain in that ankle, and you're specifically going to have pain in that ankle when you weight bear on it, when you try to walk on it. And that's your brain telling you, okay, let's not put as much pressure on this right now, because the body needs time to do its work and to do its job of trying to heal it up a little bit more and strengthen those tissues again until we can gradually increase the amount of weight you put onto it. So it's a protective mechanism. And then as the ankle starts healing, as those ligaments heal again, you can put more weight on it, you can do more activities on it, and that's physiotherapy in a whole. The other type of pain, so let's talk about like post-mastectomy or radiation pain. After quite a few sessions of radiation, you might experience some skin burns. During that time period, certain tissues or materials on that skin does not feel good. You don't want to kind of bump into that area. You don't want the sun to be hitting that area. It can be much more easily aggravated. And again, same thing, that is your skin realizing that it needs a little bit of time to heal. And so your brain is telling you, okay, let's reduce these aggravators that can be affecting the skin and allow the skin to heal, allow nerves in that area to regrow after certain scars. And again, it's protecting us. It's doing the job that it was meant to do. Oh, so that being said, what do you do when you're in pain? And I will always say that it's important to bring it up. So at no point would I say, oh, you experience pain, don't worry about it, don't bring it up to anyone, which is seems simple and seems like common sense, but as a physio, I see many people in clinic say that they've had this pain for 9 months or a year, and they're just starting to check it out now. So my usual recommendation, if you have pain and you have had it for longer than 3 to 5 days, so it's normal if you kind of, get a bump or bruise or a quick strain and it gets worse and then it gets better and it's pretty much gone by 3 to 5 days. That's normal. But if it's lasting longer than that, it's really time to get it checked out. So you want to go to your doctor and rule out potentially more serious medical conditions. It could be autoimmune conditions like rheumatoid arthritis or a spinal cord injury, an infection. They want to maybe check your thyroid. So it's always a good idea to get it checked out. And then even from there, you might want to check out anything that's less serious, but also important to know. So did you fracture your foot when you sprayed your ankle? Did you tear a muscle group? Is there a nerve root compression? Things like that. So I would always say go to a professional and get a diagnosis first. But as you get the diagnosis and you know what's going on, the natural pain process is that it doesn't just continue to occur. It should go down as the body heals itself. So again, like I recommended with that ankle sprain or that soft tissue healing, another thing is if you're getting some sort of organ pain or pain related to a tumor compressing on something in your body, basically as that chemotherapy, as that radiation, as surgery, as different treatments that you might be trying out right now, as that does its job, then the healing should be occurring and the pain should be reducing as well. So that's the normal healing process that we should expect. And often it doesn't go away in a week. It takes work and it takes time. So it can often take weeks to months to get better. You may need, and this does not mean to be a plug for my profession, but I do think there is some merit to it. But it may need a course of physio to help you with muscle strengthening, maybe getting your range of motion back, making your gait or your walk look better, no more big limps, and then just getting back to things you love, right? So if you want to be playing pickleball or going for walks or any sort of activity that you love doing, maybe it needs some activity related exercises for that to kind of re-strengthen your balance. But really the main thing I'm trying to say is it should be gradually improving. So that's just generally how pain should work and should go away. But then there are people with consistent pain or persistent pain or chronic pain. Why is that happening? And so we're going to zone into this stat that I mentioned before, that 39% after curative treatment are still experiencing that moderate to severe pain. So why? Like, why would you still have pain if the soft tissue healing has occurred or after the cancer treatments have rid the body of any disease or tumors that may be compressing the body's well-being? And this is what we want to talk about today. So persistent pain, it can last. It's not a fun experience. It can be confusing. Maybe you've had the experience of going to multiple professionals and not feeling like you get an answer from why this is still occurring. Maybe that you've tried various medications. So why is this happening? And this is because you definitely can still get symptoms of pain even when the reason for that pain is no longer there. So for example, I always go back to like a sprained ankle because it's just a simple way of explaining this. But after the ligaments of the sprained ankle have healed, why would there still be pain if you should walk on that and not have a problem with it? So this can happen with chronic back pain, where people have had x-rays and MRIs and various images that kind of show just normal degeneration in the spine, nothing big, or skin sensitivity. I get this a lot with people after surgeries. where the scar has healed, the swelling has gone down, but yet it's still really difficult to touch it or to have different materials kind of rub over it. You're always a little bit more anxious still around that area. Why is that the case? And really, we like to explain the brain in the physio world as a fire alarm. So what can happen sometimes is it does its job. So let's say you're cooking in the kitchen, small kitchen fire starts, the fire alarm goes off, and it warns you, okay, there's a fire in here, we got to do something about it. So the fire in this case is the injury. The fire alarm is your brain figuring that out. And that's all good, right? That's the body working as it should. But then the next day, you put a piece of bread in the toaster, and you have a little bit of smoke come out of it, and the fire alarm goes off. And that's where the fire alarm or the brain is getting a little bit too hypersensitive to smoke signals. And it could be because of the past experience, it's on edge because it's had a fire occur before. But then the brain can kind of just stay in that state where it perceives events as dangerous or threatening, even though they shouldn't be anymore. So that's kind of the example we often give with chronic pain. So why can this happen? And there's so many reasons for this to happen that have been found in the literature. And here are just a few of them. So if you notice from this slide, the top three on the top right hand side are all to do with fear. And we mentioned that a lot in different reasons because that's a huge one, right? So the first one can be just the fear of the pain itself. You don't want to feel the pain. And so sometimes people withdraw from certain activities. For example, if you sprain your ankle and you walked on it and it got really painful, it's not a fun experience to experience pain. So you might just slowly stop walking on that ankle a little bit more. Maybe you have fear of reoccurrence, which is a big one in cancer-related pain. Fear of not recovering. Maybe there's depression or stress or anxiety to do with this. The stress doesn't have to be about the injury. The stress could be from various other things occurring in life. Maybe it's family related or friends related or work related, legal stress, financial stress. Any other stressors that your body is perceiving or your brain is perceiving from different events can also then affect the other pains that are going on in your body. Withdrawal. So withdrawal can mean you maybe haven't been able to do the activities that you enjoy doing anymore. Maybe that's not even the physical moving activities. Maybe it's the isolation of COVID-19. Maybe it's not seeing people as much. Maybe it's not doing a hobby like painting or singing or music as much. All of those different sort of withdrawal from activities can increase the pain. And then another one, imaging. Now this one, people don't really expect this as much. And I would like to say that I am very thankful for imaging. In no means am I saying imaging is bad. Imaging has been a wonderful thing that has been able to pick up disease and pick up things that we wouldn't have been able to before it was invented. So I think it's fantastic. However, there are some fears to do with imaging, and maybe it's more, I would blame it on the healthcare professionals that are doing the imaging that might have caused these fears. So for example, I have a lot of people who come to physio who bring along their x-rays and their MRIs of their backs, let's say, and have been told that they have a slipped disc or there's lots of arthritis in the back, or it could be any joint. I'm just using back as an example. And I take a look at these imaging and they say some evidence or impressions on the images, but it's nothing more than what the general public should have going on in their back. So after the age of 30, everyone should have some arthritis in the back. A lot of people have disc bulges or disc herniations without the relation of pain. So sometimes we kind of zone in too much to do with the imaging, and that doesn't help people's fear surrounding their injury. All right, so let's talk a little bit more about persistent pain. So another question a lot of people have is, well, how come one person had pain, ongoing pain from their surgery, and another person didn't? And that's because we are different people. So I gave this example of a roller coaster. I don't know if anyone has been into Wonderland and have seen those like big drops of the roller coaster. And some souls are just laughing and excited and screaming with a smile on their face, as you can see on the girl in this picture. And some people are just honestly terrified of that. And that does not seem like fun, and they're screaming from absolute horror than excitement. And I don't know which group of you are in, but that's okay. We don't all have to be roller coaster lovers. But that's because, and this is what I'm trying to say, relate it back to the pain. So each brain is different. Each brain has different memories attached to it, beliefs, past experiences, maybe not personal experiences, but experiences that their family members have had. We all have vastly different brains. And so if the brain basically believes that it's in danger, it magnifies the signal. So maybe you've had a cousin who had ongoing ankle pain, and then it ended up never going away, or it was worse, or they had to stop doing activities that they loved for certain reasons for it. And you have that thought in your brain, and you just sprained your ankle, and you think maybe it could turn into that. Whereas someone else who has seen someone sprain their ankle and get better from it, no problem, right? So we all have different expectations as well. So another question I have all the time is, or maybe not even a question, but just saying to say, like, is it all in my head? And the funny part of the answer is yes, it is all in your head, because all pain is interpreted in the brain. So I'm not saying that it is fake. No, it is real in all senses, because the brain is the thing that the organ that interprets all of this pain. So it is in your head. Without your brain, you wouldn't be able to interpret pain. But it is real. So the difference between the realness of it, I guess, so the experience of it is the level of pain is the same, but it may just not be actually from a damaged muscle or bone or joint or skin. It might just be from a very sensitive nervous system, or a sensitive fire alarm, we call it. So let's jump into what we can do about it, because that's really what you are probably all here for. But to really, again, understand your pain and understand what to do about it, I just wanted to go over all of those topics before. So let's jump in. As a physio, I felt like I needed to put move as the number one here, as that's really my main certification of what I'm good at doing here. So there was a quote that was done from Beacham. He's one of a great physiotherapist. He said, if you're thirsty, drink. If you are hungry, eat. If you are in pain, move. So pretty much what I'm trying to say here is, if you're waiting to become completely free, pain-free before resuming activity, it can often lead to chronic pain and disability. So I'm not meaning if you got an x-ray back and you have a fracture and they're saying that you need to be in a walking boot for 6 weeks. I'm not saying that. I'm saying if you've gotten the diagnosis and you know what's going on, and you've been taking medical advice, and you're still in pain for much longer than you were expecting or recommended to be in pain really for a while that long, then yes, we want you to keep moving. The key thing is, how do you do that though? And it's to go very, very easy first, and then slowly increase. So for an example here, the secret is basically trying to find an activity that you might be in pain for, but it's not increasing your current amount of pain. So for example, let's say if you went for a 30-minute walk, and that 30-minute walk leaves you very painful, you have 3 to 5 days after that of feeling even worse than you would normally feel, then that 30-minute walk is not the activity for you. What you want to have is something that's short and sweet, and that your body can do without increasing or causing a flare up. So for example, maybe that's starting off with a 5-minute walk. And you get home from that 5-minute walk, you just did a little loop around your street, and you notice, yeah, I'm still in pain, but it wasn't much worse than I would have been before. And that is an experience. That is a new memory. That is something that your brain is interpreting and thinking, okay, Caroline just went for a walk and it didn't increase my pain, so maybe I should actually reduce my level of sensitivity to that action. And with that, your brain reduces its fear around that activity and actually reduces that nerve sensitivity to that pain. And then what you want to do is, you don't want to always stick with only a 5-minute walk for the rest of your life. You want to slowly and gradually increase that amount of walk. So, and I would pick one way of making that harder every time you go. So I wouldn't then suddenly go to a 10-minute walk and a faster pace. I would pick one of those. So maybe the next time you go for 10 minutes. Maybe the next time after that, you go for 10 minutes, increase the walking speed just a little bit more. Maybe the next time you go and you do the same walking speed, the same time, but instead of on like an even ground, you go on a field or a hike and it's a little more uneven. So all of those little different ways that you're slowly increasing your tolerance to that activity. And that being said, let's say you suddenly hit 15 minutes on uneven ground and, oh, you had a flare up. Go back to where you were before, do the one that's friendly on your pain for another maybe 2 or 3 times, and then start increasing it again. So that is my general recommendation there. And to back up what I'm saying, there's been a study on this. I think it was in 2018 on breast cancer patients, and those who did a 12-week exercise program. I think they exercised 2 times each that week for a 60 or 1 hour session. At the end of those 12 weeks, the group that was in the exercise group reported significantly less pain and significantly less frequency of that pain as well. So this is backed up by literature. I'm not making any of this up here. Another thing that you can do, so that movement was more about, yeah, an activity or an exercise. Another thing that can be very sensitive to pain is skin. And so maybe you've had a surgery, and maybe around that scar, whether it was an abdominal surgery, a mastectomy, or just an orthopedic injury where you broke or fractured a bone and you still have scars from them doing a surgery there. Sometimes those areas can be very sensitive, and we call that allodynia or hyperalgesia. So allodynia is where you experience pain from something that shouldn't be painful. So for an example, if you brush a cotton ball against your skin, that shouldn't be painful in normal times. But for you, that is in that area. Or hyperalgesia means that you should have pain from something. So maybe, let's say you have a pinprick in an area. Yeah, that is a little painful, but it's nothing to write home about. But if you do that in that area, it is extremely painful. So it's basically something that is much more than it should be in pain. So if these sort of symptoms, you recognize them in yourself, this is what I would recommend. So it's called skin desensitization, and it's the same sort of thing where you're trying to increase your confidence to do with an activity. So one, for example, could be a cotton ball. You take a cotton ball, something soft, something that's very light on you, and you, if it was on my hand, I would take the cotton ball and I would stroke it around that skin area for about 5 minutes every single day. And I would look at that area while I'm stroking it, get my visual feedback to show that I'm not injuring that area. And I get my skin really used to that sensation. Then maybe after a week of using a cotton ball and feeling confident with it, go to a bit of a harsher material. So that could be a towel. Grab a towel, grab an older towel that's kind of little, like you haven't put it in the wash recently, it's a little crisp. Take that and put that on the same area. look at it again. That visual feedback is so important for your brain too, on how it perceives this. Maybe after a week you've used that and you're ready for something more difficult, use like a dry brush. So I think you kind of understand what I'm saying there. Basically increase slowly your tolerance to different factors onto that skin area. And that can be very important for, yes, skin scarring. It can be important for even like peripheral neuropathy. This is something that can be used. Okay, we'll go on to the next one, breathing here. So we all have to breathe to stay alive, but what I mean by this is intentional breathing. So there's various different ways you can get your body to breathe and be intentional about it. And one is diaphragmatic breathing. So actually, why don't we all do this together here? So if you see the picture in the top left corner here, where she's got her hand on her chest and her hand on her stomach, why don't we copycat that together? So get back into your chair, your bed, or wherever you're at right now, and just lean back, relax your shoulders, and let's do a diaphragmatic breath. So what that means is you're trying to breathe and deeply breathe to the point where you almost feel like you're blowing up a balloon in your stomach. So a lot of people end up just chest breathing and doing short breaths through their chest. What I'm trying to get you to do is breathe all the way down. So I want you to feel like your bottom hand is expanding out with your stomach as we do this. So let's go into it. So breathe in through your nose. Hold it for 2 seconds. And then exhale is like your pursed lip. You're breathing out through your mouth. Good. Let's do that one more time. So inhale. Hold for 2 seconds. And exhale. Good. Good. Now that we're all relaxed, let's keep going here. So that's just one way of deep breathing. And why this is so important is that your body needs oxygen to heal. To really do anything, it needs oxygen. To have muscles pumping and to move your arm up and exercise, you need oxygen. So it's very important to allow the oxygen to actually get to your tissues and not to just be shallow breathing in through your chest, out through your chest, and not let it actually go deep into your body. Another way that you can force yourself to breathe is exercise. So if you're doing something that gets you huffing and puffing a little bit more, again, your body is using that breath for good. Another thing is Tai Chi, and actually Wellspring has a great Tai Chi program if you're wanting to get into this. But that's working in certain movement patterns with breathing. And then another one is meditation. And that's really looking at, and there's so many different types of meditation and mindfulness, but that is really jumping into the intentionality behind your breath. And there was actually, again, a meta-analysis done on people who tried meditation, and they found same thing, that it reduces the intensity of pain, the frequency of pain, and it actually also it reduced multiple other things too, depression, anxiety, which all in turn can increase your interpretation of pain as well. So those are all important factors to reduce. Again, a little plug for Wellspring. We have exercise classes, we have Tai Chi classes, we have meditation classes. So if anything's kind of sparking interest here, take this presentation, the knowledge of it, and then jump into action because yes, that's really our goal from this session. Another one, eat. We all love eating. So it's all about what you eat too. So this information was taken from the Canadian Food Guide, which they revised their information pretty recently, 2019, and a lot of people were much happier with this revision. So just some general things that they mentioned were to make water your drink of choice. So don't rely too much on all the caffeinated beverages or sodas or things with sugar, even juices. Really make water your most common thing that you drink during the day. It's okay if you put a little lemon or lime or something to make it taste better, some mint leaves maybe, and cucumber if we're getting fancy. But make sure that you're drinking water, and often the recommendation is 8 cups a day. So count that out, see where you're at already today. And then another thing is food. So again, the food that we place in our body is really responsible for nourishing our body, which sometimes I think as a culture we are off of that, right? We're eating for fun or for excitement or for, we're stress eating, which I mean, that all happens, but the purpose of eating is really to nourish our body. So we need to give our body plenty of fruits and vegetables. So if you look at the plate of the Canada Food Guide, they make it at least half the plate is fruits and vegetables. And then a quarter of it is whole grains, and then the other quarter is a source of protein. And whether that protein comes from animal protein or plant-based protein, they recommend to start trying to increase a little bit more of your plant-based protein. So that means your beans, legumes, your nuts, your seeds. Get pretty creative with it. Try a new meal that week and see how it goes. The other thing is you might be low in certain supplements. So maybe you need to go to your family doctor and get a blood test and see maybe you're significantly low in your vitamin D or your iron or various other nutrients and minerals. There might have been surgeries that you've had that have reduced your abdominal surgeries that have reduced your ability to digest or to absorb certain nutrients. Maybe you're feeling very nauseous or you have vomiting as a symptom. In those sorts of cases, I would really recommend you see a family doctor to get your blood test and then maybe follow up with a nutritionist or a dietitian or a naturopath who are registered and see if they have any recommendations for supplementation there, because that has a space for sure. The other thing is sometimes too many things are not good. So if you have too much calcium, actually that can increase your sense of muscle aches and pains. So this is something to get help with or walk through this with someone as well. All right, let's jump into vitamin D, the sunshine vitamin. So if you're with me in Canada here, you know that we haven't had a ton of sunny days this winter. This past weekend was beautiful though. So vitamin D is very important to supplement usually in Canada. So they recommend that you need to receive at least 15 minutes of midday sun twice a week. But that can really vary. So if you have a darker skin tone, that can sometimes be up to at least 1 hour twice a week to get enough vitamin D in that. It can also vary times of year. So often in Canada, you need to supplement this in the winter. And there have been studies that have shown that people with chronic pain and greater amount of opioid use actually have significantly lower vitamin D levels. And then they've also found in interventional studies that if you then take these people with low vitamin D levels, and I wrote that on the slide, how low it has to be to benefit from supplementation, and give them vitamin D, it really does help their pain. So that is something that I would always recommend looking into with your family doctor as well. Okay, another one is sleep. So number 6 here, sleep. Sleep is very important and it can work in a bi-directional way, we call it, with pain. So the frustrating thing is if you are in pain, you often can't get to sleep. So for example, maybe you've had shoulder pain after a mastectomy, or you have frozen shoulder, or you are always used to sleeping on your left side and the surgery happened on your left side and now you can't. That disrupts your sleep. And then the same thing happens if you have disrupted sleep, you're living on low sleep levels, your pain will be higher. So we've got to change this cycle here. So these are a couple recommendations. I got these recommendations from Matthew Walker. Actually, he is a pain or a sleep scientist. He wrote a book, Why We Sleep, which some people joke that it put them to sleep, but I'm a little bit obsessed with sleep information. So I stayed awake through that all and took some good information from that. So here are kind of his main points if you're not going to read the book that he recommends. And his number 1 is actually to maintain a sleep schedule. So go to bed at the same time, wake up at the same time. If you can't do that, at least wake up at the same time is the more important of the two. The other thing is try not to do a lot of heavy exercise before bed. That'll really wake you up. Caffeine, try to reduce that. Now, the big thing with caffeine is that it stays in your system for a while. So it stays in your system usually for about 8 hours. So if you think that through, if you want to be in bed and trying to fall asleep at 10 p.m., you really can't have any caffeinated beverage or food later than 2 p.m. So that espresso nightcap is really not recommended in this. Another thing is avoid a heavy meal before bed. Take time to unwind. Leave your devices at the door. So that unnatural screen light has really confused our circadian rhythms, which is our body clock. So when our body clock sees light, it can't really tell sometimes if it's natural or if it's fake light, and it thinks it's midday and it tries to keep us awake. So yeah, really trying to not have screens before bed. Get some sunshine, avoid lying in bed for too long. So the recommendation here is if you're lying in bed for over 20 minutes and you can't fall asleep, don't keep checking your clock and stressing yourself out that you're not falling asleep. Get up, do some old dishes or something, go around, tire yourself out, maybe have a snack that has some protein and fat in it, and then try to go back in bed and fall asleep again. And then finally, talk to your doctor or pharmacist about your medication schedule. So sometimes there's medications that you're taking that can act like a stimulant, wake you up a little bit more. And there are some medications that can cause you to be drowsy. And so using these to strategize how you can sleep better and wake up better will work in your favor. So talk to your doctor about that. Pharmacist, often you can call them and actually book an appointment to talk through your medication once in a while and go through how to take those properly and to your advantage. So book that if you are interested. And then we've got one more here, and that's to find joy. So jump back into those activities you love. Find those activities that don't increase your pain. Maybe that's painting, singing. I mean, it's been really hard in COVID to not feel isolated. So be creative in the ways that you can still talk to your friends or family. And maybe that also means finding someone who you can sit down with who's a professional and talking to them, because that the fears, the depression, the anxiety is all mixed with your pain as well. And so reach out to someone because it's not an easy process. And exactly also why Wellspring, we're trying to be here to help you through. So this is just my last slide here to say, I know that we're getting to the end of the session, so I'll try to wrap it up here, but this is to say that there's two different ways of coping with pain. There's active coping and there's passive coping. And there has been studies on people with cancer, and they found those who actively coped with their pain versus passive had, again, significantly better effects on their pain. So they had a reduction in their pain frequency and intensity and severity. So I just want to say good job to anyone who signed up to this webinar, because already by doing so, you're trying to more actively cope with your pain. So if you look under the active column, this is for people who are trying to understand their pain, understand why it happens, no longer fear the flare-ups as much, being able to set goals about their pain, pacing themselves on functional movements, and feeling confident that they can return to life in a new way. Whereas they found that people who passively cope with their pain, so they're more fearful, they're trying to avoid activities, they rely on healthcare professionals to not only find the diagnosis or problem, but also try to find the cure. And then they kind of rely on medications or gadgets or adjustments, kind of like that short-term relief benefits. And I'm not saying those short-term relief benefits have no place. I do think they do have a place during those flare-up moments. But only relying on them is not going to help in the long term. So that cycle of persistent pain can keep going when it's passive. So here are just, again, some resources that I mentioned on Wellspring. You can find them all on the Wellspring website. I mentioned that Nourish and the meditation and Tai Chi. And we also have a group exercise, and that's one of the main things that I'm a part of here. So that means 12 weeks of 2 times a week you can hang out with us online and get some free exercise classes. So it's actually in a group, which is really helpful for accountability. There's usually like max 10 to 15 people on Zoom all together. You don't have to have any exercise equipment at home. Just grab your cans of soups or whatever you have. We'll make it work. And we go through certain exercises, a warm up, a cool down, the strength training to get your heart rate up. And don't worry, if you've never exercised before in your life, you will be able to use this well. There's low or moderate classes, and we are watching you to make sure that you will not harm yourself. So join in if you want. It's a very fun class, and it gets you going. So I think that's all I have for today. There's quite a few references that I used. If you have questions or want to look up anything, feel free. And then I think I will pass this on to Vinitha again. If you have any questions, yes, I'm happy to try my very best to answer. So easy questions only.